Thank you for joining me. We had another question come in on why insurance doesn't cover integrative care and what is standard of care and how are those two related. Simply put, insurance covers treatments that have been approved by Medicare. Now, if any of you know what Medicare approves, that's very limited, especially when you're talking about the type of detailed diagnosis that you get in integrative medicine. The difference between an integrative doctor, functional medicine doctor, generative medicine doctor, all these names for these doctors, we're looking at what's going on in every area of your body to see why you're sick, what are the causes of your illness. Medicare doesn't really work like that. The more conventional model is, well, here, just take this pill and we'll see you in a couple of days, and it's 10-minute office appointments, and it's more management than it is really finding out why that patient is sick. That's not true for everything, but that's true in chronic disease. We see that a lot, and I think a lot of integrative doctors would agree with me. Insurance doesn't cover the latest in laboratory testing. They cover like maybe your standard LabCorp tests, which some tests may be run that way, but then there's esoteric or more specialized tests that they don't cover. And then they don't cover the treatments, because a lot of the integrative treatments that may use vitamins or phytotherapeutics or even sometimes medications for the purposes they're being used, that's not standard of care. So what is standard of care and how's that tied to insurance? Standard of care is pretty much done where doctors that have a particular license, allopath, osteopath, naturopath, are using typical treatments to treat people, and it becomes kind of known in the industry that if you have this, you give this. And in fact, if you look in algorithms that doctors use to look up prescriptions in the standard of medicine, they'll say, oh, you have pneumonia, these are the antibiotics that are appropriate for your pneumonia, and they're prescribed. So that's standard of medicine. The reason you don't have standard of care in these types of complex chronic diseases is because everybody is really different and their causes are different. And the more you diagnose and break down infections, immunity, gastrointestinal issues, neurological issues, hormonal issues, genetics, understanding how their body can eliminate things, inborn errors of metabolism, all that stuff, you now come up with a really personalized treatment plan, far better than standard of care, much more detailed. The difference is like night and day, but insurance doesn't see that as valuable and hasn't caught up to that yet, and hopefully they will someday. They can't deny you if you go to the ER with a broken bone, but they will start denying you if you're using integrative care for cancer, chronic diseases, autoimmune diseases, Lyme disease, because a lot of these things are considered to be elective procedures. There's a lot more complexities to that, has a lot more to do with laws and regulations, but nonetheless, that's my quick little answer. May God bless you on your journey to healing, and I hope that helps answer at least a little bit on that question.